It's appropriate for a keynote speaker to begin by saying, I'm delighted to be here as we discuss improving the quality of health care in Brooklyn again. It's the again that's the problem. We warned that numerous institutions were on the brink of collapse, and those predictions have come true. Litch and Interfaith are in crisis and confronting bankruptcies. Others are not far behind. At least 4 hospitals we studied are clearly not viable in the long run, and frankly, to make things interesting today, I would now add Downstate to that group. SUNY Medical School should continue to play a central role in providing trained medical personnel for Brooklyn. But by the way, it is obvious that medical education does not depend on owning and running a hospital. Frankly, Downstate has passed its useful life and should be phased out. The new primary educational relationship should be between SUNY Medical School and Kings County Hospital. But as we watch Litch and Interfaith being played out as a political, and Lord help us, a judicial football, it's obvious we have to move quickly to find a better way. There's no silver bullet. Hanging on to be the last person standing, kicking the can down the road to avoid tough political choices, or holding political rallies is not a plan or a planning process.
What's your reaction to Bill de Blasio's statement in the debate the other night that the most important thing is to keep Brooklyn's community hospitals open?
I would tell the leading mayoral candidate, who can only lose this election if he gets, if he falls down a manhole, it looks like. I would tell him that hospitals are a part of the healthcare system. They are not the healthcare system. I would tell him they play an important role and have to play a transitional role, but that if every hospital in Brooklyn that had closed in the past had not closed, the quality of the medical care that people have today in this county and in other places around the state would not necessarily be any better. It is episodic care. It is not continuity of care. We have too many people inside, upstairs, who should be at home being taken care of.
What would draw private capital to Brooklyn, given the payer mix and the demographics?
Right. Well, a couple of things. First, we have to do several things. First, I mentioned one thing. We have to get our costs down. So, in fact, by the way, whether you're a private, capitally supported institution or an institution that is a not-for-profit or even a city or state institution, you want to have an operating surplus. It is not a sin, okay? It is actually okay, because that's where you get the money to reinvest in the facility, to upgrade care, and to keep the institution modern and functional. There are privately financed, funded hospitals all over this country which actually take care of people in all kinds of communities, including communities where there are issues of poverty and discrimination. They manage to do it. They manage to do it because they learn how to manage their costs, their delivery systems, and make it work.